Assalamu alaikum. My name is Ikra Badr and my roll number is BP1650090 and my group number is 35. So my topic for presentation is dosing of drug in renal failure. First of all, we should know what is renal failure. Renal failure is basically the condition in which the kidneys stop working properly and they are not able to remove waste and extra water from the blood. Hence, the chemical balance is completely disturbed in the body and this can result in acute or severe kidney failure. What can be the symptoms? Decreased urine output, fluid retention. This can cause swelling of legs, ankles or feet, fatigue, confusion, nausea, weakness and irregular heartbeat. Dosing of drug in renal failure. In the condition of renal diseases or renal failure, the drug doses should be reduced as accumulation and toxicity can develop rapidly if doses are not adjusted in patients with renal problems. Renal diseases interact with drug in three different ways. Firstly, the patient with kidney problem may be unsafe or prone to the drug given, that is patient susceptibility. Secondly, the drug effect is reduced in the patient with renal problems, that is pharmacodynamic change. And thirdly, the clearance of drug is extremely decreased, that is pharmacokinetic change. This can be summarized in one sentence, and we can say that the drug dose should be reduced proportionally to the predicted reduction in drug clearance. If we reduce drug clearance, the drug will stay in the body for longer period of time and it will produce more effect. But in case of renal problems, the renally cleared drug should be reduced. Continuous ambulatory peritoneal dialysis. Now, this is the method of artificially removing the waste fluid and poisons from the body using our own abdominal membrane, that is peritoneum. Now, peritoneum is a natural filter which is richly supplied with tiny blood vessel and it lines up the space of our body known as peritoneal cavity, or we can say it as abdominal cavity as well. How this whole treatment is done? The treatment of CAPD is done by placing 2 quarts of cleansing fluid into the abdomen and then we will allow the drainage of fluid. This is done by attaching a plastic bag of cleansing fluid to the abdomen. And then the abdomen is filled with a fluid known as dialysate. Then we will let this fluid remain there for a prescribed time and then this fluid is drained out. Fluid moves through into the abdomen and throughout of the abdomen by the help of a flexible tube which is known as catheter. This whole process of dialysis exchange is usually performed 4 times a day and each session takes 40 minutes. Now, this is the principle of peritoneal dialysis. Here we have a solution bag and here we have a drainage bag. This is the tube which is known as catheter. The solution bag consists of cleansing fluid and this cleansing fluid will be inserted with the help of this catheter tube into the abdomen. And also by the help of this catheter tube, the fluid is drained out which was previously present into the abdomen. Case study. A 24-year-old man with ESRD is maintained with CAPD. He presents to the ED fever of 38.2 degrees Celsius and complains of severe abdominal pain. He also reports that his peritoneal dialysate has become cloudy over the past few days. All these symptoms are consistent with peritonitis, a frequent complication of CAPD. His culture reveals E. coli sensitive to gentamicin. How should gentamicin be dosed in this condition? Soap notes. First of all, we will discuss about subject. Fever 38.2 degrees Celsius. He was complaining about severe abdominal pain. Also, his peritoneal dialysate has become cloudy. He is also suffering from peritonitis. Objective, his culture reveals E. coli sensitive to gentamicin. Assessment. We will change the peritoneal dialysate and we will adjust the dose of gentamicin plan. First of all, we will manage the dose of gentamicin so that this dose become equilibrium to the dialysate concentration. Then, as the patient was complaining about peritonitis, so we will start giving the patient antibiotics. and this will be administered intraperitoneally. Notes. The condition of the patient will be tackled by using the altered dose of gentamicin. The dose will be 8 milligram of gentamicin into each liter of dialysate, or we can double the dose as well, that is 16 milligram into 2 liter bag of dialysate. Then, as the patient was dealing with peritonitis, we will start giving antibiotics, and this will be given intraperitoneally. What antibiotics will be given? We can also give beta-lactams, cephalosporins, or quinones. This depends upon the severity of the symptoms. Now, a question is arise that is gentamicin eliminated by CAPD? As we know that there are certain drugs that are not removed through CAPD, but there are certain drugs that are highly protein bounded and that have high volume of distribution. They can be eliminated by the process of CAPD. And this drug which we are using, that is gentamicin, this drug is less protein binded and has low volume of distribution. That is why only 10% to 50% of the gentamicin will be removed by CAPD process. Thank you.